Here's a live look outside from our Avenida Houston cam, looking over Discovery Green, folks. Welcome back to
Great today.
So chronic sinus symptoms like headaches, facial pain, and breathing problems can all affect your quality of life. And unfortunately, the recent weather we've been having, maybe a hurricane or
That's
two,
right.
Could make those existing issues even worse.
But there's good news. There is a minimally invasive technology that could help put an end to your sinus pain. Dr. Vincent Honrubia with American Sinus Institute is here with the details. Hi, Dr. Honrubia.
Hi, thank you for having me.
Okay.
So let's talk about this. Have you been noticing kind of an uptick in folks coming to see you since the storm and since our air quality's gotten so bad?
We have noticed that, and also that this recent exposure to all this dirty water, people swimming out of restaurants, people moving around in water, putting their head under this water that has a lot of bacteria, causing lots of problems and a lot more complicated infections that people ordinarily wouldn't be exposed to.
And in the beginning, I mean, a lot of people didn't really have a choice but to go through the water. I mean, a lot of people were sort of recreating in the water. I don't know if you saw those videos on YouTube of people like jumping in, water skiing in it. But some of those people may have residual issues as a result.
That's correct. You know, just like people are getting these chronic skin infections and things like that, the sinuses are open cavities that aren't supposed to be exposed to this type of bacteria. And one of the things we do with this procedure is not only we open and clean the sinuses, but we also rinse the sinuses out.
So talk a little bit about the procedures, because this is designed to be minimally invasive. This isn't to give you a bunch of downtime later.
Correct. This is a procedure done in the office that takes about 20 to 25 minutes. It's done with anesthesia, with an anesthesia provider there, using small balloon catheters to go into the sinuses, open the sinuses to their natural opening, and then at the same time rinse out the chronic infection that sits in the sinus.
And when you say anesthesia, is it, you're not like totally out, right? It's not general anesthesia?
It's not general anesthesia.
So it's a
IV
local.
sedation.
Okay,
IV sedation.
so you're awake during the process. We're seeing some video actually behind you.
Okay.
So as you mentioned, these that tiny little balloon slips up there.
Right, the tiny little balloon goes in. It opens the sinus by pushing away and creating space by compressing tissue in certain positions. And then after that's done, we rinse and clean the sinus out. So when you do have the procedure, this procedure in our office with a Honrubia Technique, you are not conscious that you're having the procedure. So there's no pain, no discomfort, but people can return to work the next day. There's no bleeding, there's no bruising, there's no indication you had a procedure done.
So how does somebody know if what they're going through is just kind of seasonal stuff, seasonal allergies, or if they really do maybe need something like this?
Well, I think in the past, before this incident, it was easy to tell because you'd be in a long-term situation where you're chronically taking medications over and over. Now it's going to be very hard to tell, especially if you didn't have any sinus problems before and now you're having a problem. It's going to be hard to tell without having someone examine you, do a CAT scan, study what's going on. If you really have some acute unusual bacteria in your sinuses, it's hard to figure that out without professional advice.
And Dr. Honrubia, we've spoken, you've been on the show before, but it's interesting. I've heard from your clients say, I can't believe I waited so long to do something like this. It made such a difference. And I think many of us who maybe are a little averse to having any sort of surgery done. This is an outpatient procedure. There's no pain. You've done more than 3,000 of these surgeries. So there's really not a lot to worry about, right?
Not a lot to worry about. Covered by your insurance. Not a lot to worry about. People return to work very, very soon after procedure. And like we have a long track record of working well with the patients, getting good results, publishing our data. We're very open about what we're doing.
So instead of just continuing to live with the symptoms, people can go in, and actually we're seeing some video right now of the office. I mean, how much time would someone expect to pass until they're breathing normally again?
People come in with this procedure. You see them there getting the CAT scan on the TV, but what they do is they come in, they get scanned, they get examined. The procedure, like I said, it happens in the mornings. Often patients go to work the following day. Some patients have even gone to work the same day, just depending on how bad they want to go to work. But like I said, it's a minimally invasive, effective way of treating your sinusitis, getting you off medications, cleaning your sinuses out, giving you peace of mind that you can do well and have good results with a very minimally invasive procedure.
Do you hear from people that this really is life-changing for them, you know, from that life of the Sudafed and the Advil and all of that to keep the pain and pressure down, and now they can breathe again?
I have patients that after they have the procedure, they ask the nurse to lay them flat, and they'll breathe through their nose for the first time laying flat, and they'll cry because I've never breathed through my nose laying flat ever. Whenever I went to sleep, I was snoring, I couldn't breathe. I've seen 250-pound men lay flat and start crying. I can breathe through my nose. So it is a very dramatic thing. Once your nose is open, you can breathe better, less headaches, less drainage, less infections, better sleeping patterns.
And you mentioned the headaches too, because it's not just about breathing. A lot of people have that pressure that leads to headaches that really can distract you from your day and be debilitating.
That's correct. So people that have chronic facial pain, headaches, drainage, even ear symptoms, ear popping, we do balloons with the ears as well. So there's a variety of symptoms that you may not think connect to your sinuses, but they are. Smell issues, headaches, sleeping problems, ear popping, sore throat, clearing the throat, all those can be related to the sinuses.
All connected.
Yeah.
And you guys are doing something really cool. You're donating $10 of every copay toward the Harvey Relief Fund
Right.
now.
So to try to give some relief to the citizens of Houston, we're taking $10 of each copay from each patient and donating it to the Hurricane Relief Fund here locally in Houston.
And this is so easy. If you want more information, you want to talk about if this is right for you, you want to schedule an appointment, all you have to do is call 713-BALLOON, 713-225-5666. You can also visit online. You guys have a really informative website online at AmericanSinus.com. So that was it's really helpful.
Yeah, worth looking into for sure. Because I know when I moved to Houston, I suddenly started having these issues.
It's a different world here. You know,
is a
air
different
quality's
world.
not the best. We have all these allergens, and now these people have been in their houses cleaning out mold and drywall for the last couple of
Mold's a
weeks.
big deal in the sinuses. It's a big deal. It's bad. Sinuses do not like mold.
Yep.
All right.
All
Dr.
right.
Honrubia, thank you so much for stopping by.
Thank you for having me.
Yeah.
All right. Now, coming up after the break, from filing taxes, we're still talking